Nearly 44% of African American men and 48% of African American women have some form of cardiovascular disease. That includes heart disease and stroke. African American adults are much more likely to suffer from high blood pressure and heart attack and stroke deaths than white adults.
One of the health concerns that I see in the African American community is cardiovascular disease and sudden cardiac arrest. It claims the lives of individuals before they can reach a hospital. What triggered me to become an advocate for the African American health issues is that my 15-year-old son, Darius, fell victim to sudden cardiac arrest while playing a non-competitive basketball game. We were in a facility that had an AED, an automatic external defibrillator, that was locked up in the weight room. This was a big concern for me, behind the fact that when my son fell victim to sudden cardiac arrest, we had no policies or any procedures set for if something like this happens. What I have done to help improve my concerns with cardiovascular disease is that I created a foundation called the Darius Jones Foundation in partnership with other organizations that go out into the community, and we teach hands-only CPR. What I feel that needs to happen so that we can improve what happens in our African American community is that we do more outreach with our community members. We teach them how to be individuals that can save another person's life. Like, not be afraid to touch a person, not be afraid to reach out and do what's needed to be done at the time of an emergency. The kit has a mannequin, a DVD, and a booklet. The mannequin is blown up so that we can do compressions on. The DVD is used to visualize exactly what steps need to be done to save a person's life. And the booklet is used as a tool so that if you do forget, you can always have that as a reference.
Diabetes is the 5th deadliest disease in the U.S., and it's hitting Black communities especially hard. African Americans have a 50% chance of developing diabetes. Type 2 diabetes is both preventable and manageable. If current trends continue, Black men will be facing an epidemic of diabetes by the year 2050.
One of the biggest health concerns that I definitely see is the rise in African Americans being diagnosed with diabetes, whether it's type 1 or type 2. That seems to be one of the biggest issues that I'm personally seeing. As community advocates, as we try to raise that awareness, we try to create community events that encourage and empower people who are living with diabetes or any chronic health condition for that matter. We try to, host these events that encourage people to make their health a priority. When I completed Ironman Wisconsin in 2005, and I was, fortunate that God gave me that title of being the first African American diabetic in the world to do an Ironman, I didn't understand what that really meant until I created a website and I started doing a lot of community events. And that's when you realize how important, how people are looking for something or someone to guide them.
I work at a call center for Covered California, which is the California arm of the Affordable Care Act. I've received phone calls from African Americans all over the state, people from all over the state, but a lot of African Americans all over the state who have questions about what's available. They have jobs or they're self-employed. Self-employed people have been paying a lot of money for insurance. Now they can get help paying for it now through Covered California. But one of the main concerns of health in the Black community is this: high blood pressure, diabetes, sickle cell, and one of the main killers of Black men have been prostate cancer until just recently. My motivation for addressing African American health issues came from my own family. I suffer from BPH, and high blood pressure and type 2 diabetes. My mother was a type 1 diabetic, and I had old cousins and relatives when I grew up who went blind because of diabetes. I had an uncle who lost limbs because of diabetes, and that was a terrible thing to watch a person go through that. So my motivation is to help educate and inform and just be a role model for stepping up on getting your health care taken care of and health needs addressed.
Overweight and obesity in children are significant public health problems in the United States. Data shows African American adolescents ages 12 to 19 were more likely to be overweight than non-Hispanic white adolescents. Let's Move is a comprehensive initiative launched by the First Lady dedicated to solving the problem of obesity within a generation so that children born today will grow up healthier and able to pursue their dreams.